In the previous session, Clémence and Luna were speaking about ways well, she spoke about pleasure, in essential pleasures in the body, and Luna was speaking about ways to avoid pain following, of course, the surgery that you had, and as the pain that you have had as FGM victims. But what I have the privilege of explaining to you and introducing you to is the work of Betty Dodson. Dr. Betty Dodson is a sexologist, and she has taught about masturbation. And I'm saying she has taught because now she is no longer with us. She died just 2 years ago at 91 years old. And you know, at 91 years old, Betty Dodson was still masturbating. So she's certainly a role model of somebody who really loved herself and was very comfortable with her own sexuality. So, so what Betty Dodson has done when she heard about what FGM victims have been through and that the surgery is there, she wrote a prescription, like a doctor would write a prescription on what you could be doing or should be doing after the surgery to recover your feelings. And so the feelings in your clitoris and in your vulva. And so the prescription, which I'm going to send you, is very detailed, every step by step. But one of the things that you will need to do is make peace with yourself. And I know it's not easy with the trauma that you have undergone, but it is now that the surgery is over and that you have recovered and starting a new chapter of your life. It's time to make peace. And one of the beautiful ways to make peace is, and Dr. Betty Dodson explains it in her prescription, is to do a self-exam. And I would like to say self-love exam of your vulva. So what do we do? The way you set this up is you are going to set up a very comfortable place in your home. And, maybe it has to be a private room because you're going to be by yourself. You're not sharing this with your partner. This is just by yourself where you are going to be rediscovering your beautiful garden. So prepare that room, put some candle lights, make it beautiful, the way women know how to make a room beautiful. And make it, make sure it's warm, maybe some light music, I don't know. And then, and then you can recline. You can recline maybe on the bed. I don't know if you will be in your bedroom or in the living room or on the couch, or very, very comfortable. And of course, you are nude. Nude so that you can explore your vulva. And you're going to need a mirror, and you can also use your phone, because, with a camera, you can, just like you would take a selfie, and you take a look. And so you're going to be looking at your vulva. But you're going to be looking at it in a way that you have never looked at it before. Okay? You want to look at it like a proud woman. Like if you had bought a dress yesterday and now you're trying it on and you're in the mirror and you're looking at how beautiful you look. You pick that dress, it looks really good on you. And now you're just admiring yourself. And so now it's the time for you to admire your vulva the way you would admire yourself wearing a beautiful dress. And so when you're looking at it, of course, that vulva has been through trauma, but what you want to look at is the beauty of it. there is beauty in it. And so it's very important that when you do this exercise, that you go with no judging at all, a very gentle heart, and you start to look at, maybe you like the lips, the lips that look like drapes. And in your mind, you want to look at it like, it's the most poetic thing that you're looking at. Some people are very good with words, describing in a poetic way something that they like. But however you're going to be looking at this, you have to have at least 3 or 4 compliments with what you're looking at. Okay, so it's like you're looking at your face, and you may not like your nose, you may not like your cheeks, you may not like your teeth. I don't know, but I know that in your face, there is something that you like. So it's going to be the same thing for your vulva. You want to look at the things and admire the things that you really like about it, and find as many things as possible. Why do we do that? Because when the vulva feels that it's being loved by your brain, that it's attached to, then it's going to start functioning better. The nerve communication is going to work much, much better once you have made peace, once you have said, okay, I know what we've been through, I know about the past, but now you and I, it's like, you're like a child. You and I, we are moving on to a different life. We are turning the page, right? Okay. So that's the first thing. Now, the second thing is, once you have made peace, and maybe it takes, more than one time to make peace. Maybe you need to look at yourself every day for months. I don't know how long it takes for your mind to let go and to say, okay, I forgive whoever did this to me, and I'm ready to move on. Okay. So now, the second thing, of course, is to do self-stimulation. Okay. And so let me show you. So it's going to be a little graphic, but of course I'm going to do it just with my pens. So here we go. So do you see my pens there? All right. So the clitoris looks like that. Did you know that? Wow, it's big, huh? So what the circumciser cut was actually just a little tip there. She didn't cut very much. The clitoris is as big as that. So she didn't, sometimes the girls say, the patients call me and they say, they cut off my clitoris. It's impossible. They couldn't do it. And I'm going to show you how the clitoris fits into your anatomy. So here we go. So this is your vulva, okay? And it fits like that, all right? So the clitoris is out, okay? And then you have all this part that's inside, all this part that's inside, you see? Okay? And so, when Clémence, was it Clémence or Luna, who was saying that, the vulva is like the clitoris is like a penis, erectile penis. It is really the truth, because all of this tissue can be gorged with blood, and it becomes really hard. And I'm sure you felt that, maybe when you were excited, when someone was penetrating you, and you were, it was really hard around the lips there, right? So this is how big your clitoris is. Now, what we want is, of course, to stimulate the clitoris, the new clitoris that has, kind of been brought up to the surface by the surgery. And even if you think it has receded a little bit, don't worry about it, because it's still very close to the surface. So, what you want to do is use maybe some vitamin A or vitamin D, as Luna was saying. But Dr. Bowers also recommends avocado oil. But of course, in Kenya, you may have some other sort of oil that is make sure that it is safe to use around your genitals. Okay, and so you have that oil on your fingers, and you start touching your vulva, and it feels good for me. So some people like very light pressure, some people like harder pressure. It depends on the person. Sometimes after the surgery, you need a little bit harder pressure just to revive all these sensations. And little by little, you see what sensation you have. And if you want to have a little more sensation, you can also use vibrators. So you see all the pink here. I have a vibrator that is pink too. And so you're thinking, well, what does she want me to do with a vibrator? Because this looks like, I'm going to put it inside my vagina. You could. But the purpose here that Betty Dodson is, teaching us to do is to use it for an outside purpose. So that means to stimulate the clitoris. So like I'm turning this on. Okay. Takes a minute. I don't know if you hear it. Okay, so it's vibrating. And so what you do with a vibrating clitoris is, the vibrator, you're putting it on your clitoris. Okay? And it feels so good. It feels so good. And so you're exploring with your clitoris, but be careful with those machines because be careful with these machines because they feel so good that we have a tendency to want to keep it on our skin, and it will burn your skin. So you use it moderately. And in fact, what Betty Dodson suggested is that when you use when you use the vibrator, you want to. She said you could do a rocking motion, kind of like Elvis Presley. She says like Elvis Presley. You know how he would use, move his hips, and so you go in front and back and front and back. So when it's in the front, it comes to get that vibrator, and when it goes back, then it's, so it's not on the clitoris the whole time. So, and this maybe during the first few months of your recovery, over the next 3 months, because I know it was already November, maybe you want to try that. And when you invite your partner, if it's a male partner, you can have your friend with you. And I'll tell you one thing that is exciting for the guys, because the guys like it. So what you do is you have him lie down, and you straddle him, and then as you're straddling him, you are masturbating with the with the vibrator on your clitoris, and the vibration, of course, it's going to be felt by his penis inside you. And he is going to love it. And sometimes guys come a little too quickly because it's so good and surprising at the same time. So make sure that you include all this, as this helps therapeutically on your end. It can also make it fun for him as well. So. These are the two things I wanted to say. So make sure that you make some me time during the week, during at least one time a week, by yourself, and of course with your partner if you wish, and also it's important. How Clémence was saying that it's important for to touch ourselves in a self-loving way. Well, during those me time session, it's a good idea to also touch the rest of your body, because every part of the body is sensual. And it's sensual in the sense that it feels, you can feel the pleasure, but it also is very good for self-love, you know. Women who have suffered from female genital mutilation are suffering from self-esteem problems, and one way to raise your self-esteem is to give you self-love, and sometimes by caressing yourself, by really feeling your finger on your skin, feeling your fingers, your hands on your face, on your neck, and you think about nothing else. You're really in the moment, and you feel that beautiful sensation and that loving sensation that you're giving to yourself. I know we want our partners to, to caress us, to massage us, to make us feel good, but it's also really important to get the sensation from self. And in fact, it's even much stronger in the brain when it comes from self. Because when it comes from yourself, you will never, it will never go away until you die. It will never go away. So it's very good, and it builds self-confidence. Self-confidence because you can always rely on yourself for love. And of course, your husband, your partner, your female or male partner can leave you one day, but you will never leave yourself. You see. So make sure that you reinforce that self-loving in every way you can. So now we're going to start the question answer session. We'd love to know what questions you would like us to answer. You have seen now the three sessions, and of course we're going to have some more in the months to come. But we would like to know what is your feedback? What are the things that you're struggling with now? And let us help you. Thanks.